Good evening, Los Angeles. Tonight, I'm speaking to you from home, not from my normal podium at City Hall. On Monday, while I was at work, my wife called to let us know that our beloved daughter, Maya, who turned 9 this weekend, wasn't feeling very well. And after she came down with a fever, we had her tested for COVID-19, and her results came back positive. Maya is doing fine, and her symptoms are mild. And my wife and I have both been tested, and our test results have come back negative. But as we monitor Maya's symptoms and take care of her, my family is going through what so many families across this city and this nation and around the world are experiencing. And we're doing exactly what our public health officials have asked us to do after a COVID-19 exposure. Maya will isolate for at least 10 days from the time that her symptoms first appeared. And Amy and I are quarantining in accordance with public health guidelines. And I will continue to conduct the business of our city every day, but I'll do it remotely. I promised you all at the beginning of this pandemic that I and your city government would never stop working for you to confront this pandemic and to save lives and livelihoods. And in this, our toughest moment, that still remains true. Our family is incredibly careful. And what's happening in my home this week is playing out across Los Angeles and this country. As our city approaches 3 million tests administered, we've increased testing capacity to meet the moment, providing Angelenos with 41,500 tests each day. Unfortunately, our city test sites are seeing a 7-day positivity rate of an alarming 19.6%. And some of our sites have a positivity rate as high as 30%. This virus is hitting so many families, more Angelenos, more now at this point than at any moment during this crisis. 3 hours ago, hopefully, the Food and Drug Administration's Vaccine Advisory Committee endorsed the Moderna vaccine, and I expect the FDA to give its final approval in the coming days. By the beginning of next week, what that means for us here is there will be more than 6 million doses of this new vaccine shipped throughout the country, in addition to the Pfizer vaccine. I had the privilege early this week of witnessing the first frontline medical workers get vaccinated over at Kaiser Sunset Hospital. It was an incredibly moving moment where I witnessed the hope of today. But we also each day confront the horror of today, of the numbers that come in that represent lives changed and lives lost. The United States is losing more than 1 person to COVID-19 every minute. And we're losing more souls than died on 9/11 every single day. California recorded a 1-day record of 379 deaths. And yesterday was the single worst day of cases and deaths ever recorded in Los Angeles. More than 1 person dying every 15 minutes from COVID-19. Today was the second worst, and cases are double what they were just last week and 6 times higher than they were last month. The truth is what you do individually is more powerful than anything we can do in government. What you do is even more powerful than the vaccine. And we need you. We need you to be the heroes on the front lines of this fight tonight. The most important thing you can do right now is to wear masks, to stop gathering with others and to stay home whenever you can. Because simply getting together with others, whether it's one Christmas or New Year's gathering or party, could be disastrous. If even a small portion of this county and our city does that, cases will skyrocket even higher. And more tragically, so will the numbers. Because we know when infections rise, so do hospitalizations. And when hospitalizations rise, so too do deaths. Right now, we have 5,100 people in Los Angeles County hospitalized for COVID-19, a 5% increase just since yesterday. It's double the number that were hospitalized a month ago. And worse, 1,035 of them are in the ICU. Put simply, there are more people in the ICU today than all the COVID-19 hospitalizations about a month ago. And today we learned that Southern California's hospital ICU beds are now at 0% capacity, as reported by the state hospital census. You'll remember I talked to you about that happening maybe as early as Christmas. It's here even earlier. My staff and I are in frequent contact with hospital leaders and administrators, and their message could not be more clear. While they do have the capacity to add some more beds, it's very difficult to add more people in a country where there's a medical staff shortage. Across the country, hospitals are reporting hundreds of healthcare staff who are on medical leave because they have COVID, because they've been on the front lines. One hospital administrator conveyed to me in a Zoom call that if we see a similar spike after Christmas, and these were his words, we will go under. We will go under. To put it in starker relief, the state has ordered 5,000 extra body bags and additional refrigerated units for Los Angeles and triggered what's called mutual aid for coroners in our region. That means that we expect to have more dead bodies than we have spaces in morgues for them. And now we'll have to share resources across county lines. That frightens me, and it should frighten you. But it should also prepare us for the action that we have to continue. I implore you to prevent hospitals from being stretched even more than they are today. This, my fellow Angelenos, is an emergency. An OB/GYN at Kaiser today shared with us the story of delivering a baby while hearing 3 code blues sounding at the hospital. 1 new life was brought into Los Angeles as 3 lives were extinguished. Our healthcare professionals are stretched. Anybody working in a hospital is under incredible stress and strain. And they've learned, though, critical lessons from nearly a year of fighting this virus. And we're taking advantage of those lessons, turning hospitals into places that can surge their capacities in ways that they determine will help save the most lives. Thanks to our efforts and the city's partnership, we have enough PPE and enough supplies to weather the crisis in the next month or 2. But in the coming days, the county may be required to formally declare a system-wide crisis, indicating that all hospitals have run out of space and the staffing for that space. At that point, our countywide approach will look a little bit differently than we talked about at the beginning of this pandemic, when we had ships like the USNS Mercy or discussions about the convention center. Every active hospital has a detailed plan to surge where they are, detailing the steps that they have to take to expand capacity and laying out the standards for how doctors will begin to limit care. This may include repurposing non-ICU beds to become ICU beds. We have more ventilators than we had in March and April. How they might use large open areas such as conference rooms to receive patients or put up tents in the parking lot for triage and intake. They are working with the county to establish plans for rerouting patients from facilities that are already underwater to places that might have a bed or 2 left. And many hospitals are postponing elective procedures, a step we expect more to take in the coming days. The biggest concern, as I mentioned, for hospitals right now is staffing. And while they've gone to the National Register to bring in outside doctors and nurses, those registries are stretched thin. And if we're able to work with the state and county to bring in additional medical staff from other regions, hospitals have advised that it's best to concentrate those staff in existing hospitals instead of spreading them out to new facilities like the convention center. Our most important task is to listen to those lessons, to listen to our hospitals, and to empower and support them to implement their plans. And the City of LA will do just that. This is how we will save as many lives as we can, lives of people we know and love. And we continue to confront this health crisis. We will also be focused on protecting livelihoods as well. During this unprecedented time in our nation, I'm deeply disappointed that negotiations about a federal stimulus package have left our cities and our states out. It's unconscionable. This means that right now, leaders in Washington are abandoning the firefighters who are protecting us, transporting the patients, administering the tests, police officers, other public servants across America who are on the front lines of this pandemic, librarians who are taking extra shifts to be contact tracers. The cities and the states that are providing the hope and the health and literally saving lives are facing excruciating decisions about furloughs and layoffs in the thousands. Washington has to step up. This country isn't made from Washington. It's made up of 19,000 local communities, communities like ours, our neighborhoods, our workplaces, our places of worship, and our schools. This is what America is, and you cannot turn your back on us. And I implore you to put back state and local aid in a federal package now. But we won't stop our work in LA no matter what. We're doing everything possible to step up and support those who've been crushed by the economic blow of this crisis. Rental assistance of more than $100 million, utility assistance in the tens of millions of dollars, the Angelino card, legal assistance. We've helped people buy groceries. We've helped domestic violence victims be able to be someplace safe. We're housing folks who are experiencing homelessness. We're providing tests and masks and PPE to some of our most vulnerable people. But there's more that we can do and that we must do. I know a lot of you listening to this are suffering and have nothing left to give. You don't know how you're going to make your rent or pay for food. And I deeply respect that. You're who we're trying to help. For the others that are out there who maybe have saved money because you haven't gone out to as many meals, who've continued to be able to work and get a paycheck, and as we've seen in statistics, have saved in record amounts in America, I'm asking you to step up and to help. And tonight, I'm announcing something for the holidays called the Grocery Initiative for Vital Emergency Needs, or GIVEN. This holiday season, we all step up to give gifts to people we know. But it's a little different this year. Many of those gifts we can't use, and many people have said, what can I do to help somebody else who's in greatest need? So in partnership with the nonprofit Mayor's Fund for Los Angeles, we will provide thousands of Angelinos with $300 in cash assistance to help them buy groceries for those holiday meals and to pay for other essentials. It's been seeded with $550,000 from the Mayor's Fund, and I thank the Mayor's Fund for Los Angeles. But we aim to grow this to $3 million to help 10,000 Angelino families, representing tens of thousands of Angelinos, to get this one-time benefit and to help through a network of nonprofit organizations throughout this city to get to the neediest in LA. This effort couldn't be more vital because if you've lost a job or hours or part of your income, you have to make these stark choices between putting food on the table and keeping a roof over your head. And if you're subsisting on an empty stomach, you can't think about school or work. Food banks and faith communities and so many others have stepped up, and please keep giving to them as well. It's a reminder that we have power to help each other and to be part of this solution. So if you'd like to help a family with $300, or if you even give a portion of that, or maybe you can give $3,000 or $30,000 or more, please go to mayorsfundla.org/COVID-19. That's mayorsfundla.org/COVID-19. Let me close tonight with a reflection that's a little bit more personal. We're at a moment of profound fear and uncertainty and loss, a moment that's lasted longer than we had ever hoped and proved more devastating than we could have ever imagined. I often say we're not defined by the moments we hope for, but those we never ask for. Not by what we set out to do and how well we do it, but what we don't expect to happen and how well we respond. Each of us is defined, ultimately, as individuals and as a city, by the hardest moments in our lives and how we get through them. This, my fellow Angelinos, is that moment. And so many Angelinos have answered the call to meet it. Our healthcare workers answer that call every day, showing up to work in spite of the danger that they face, saving lives and offering comfort in people's final minutes. Our teachers have met the call, forging new and innovative ways to teach students from afar. Store clerks and delivery drivers, farm workers have taken on a critical mission to keep our people fed and our city moving. All of us, in every sector and every neighborhood and every corner of our civic life, have played a role. and I'm so proud of each and every one of you. For me, it's meant being a mayor, your mayor, and leading our city in the best way I know how, by being candid and clear about the difficult decisions, the straight truth, the facts, the science, and what we can do to deliver relief to those who need it most. There's been speculation that I would leave Los Angeles to join a Biden-Harris administration. And while I'm very proud to call the president-elect and the vice president-elect who's represented our state so well, not only good friends of mine, they are good friends of our city. And the task that they face in the days ahead is vast. To end this pandemic, to confront the worst economic crisis of our lives, to pull our country forward and to heal a divided nation. Since Joe Biden was elected as our president, I've continued to advise the administration about the people and the policies that they need, that can help us heal and stand back up stronger than before. And through it all, I've shared the perspective of a mayor, a local official, representing real Americans who are on the front lines of this crisis. In this moment, as so many lives are on the line, there is nothing more important to me, no task more urgent than being here as your mayor during the worst emergency that our city has ever faced. As the administration reached out to me about serving, I let them know early this week that my city needs me now, and that I want to be here, and that I need to be here. Serving as your mayor and building on your trust and your confidence is the greatest privilege of my life. It's not an easy job, but nobody has an easy job right now. And when we come together, instead of finding the things that pull us apart, we've shown the strength that you better not bet against Los Angeles, because we're not only going to come back, we are going to roar back. I will never stop working hard to find a way out of this pandemic and to walk together out of this darkness to a bright new dawn. And I can't wait to do that with the support and the friendship and the close connection to an administration that will be our friend and not our adversary. From housing to homelessness, from transportation to technology and our climate, Los Angeles will be in the vanguard. And I will work from here with this administration to lead this city and to inspire our nation. For now, my friends, our task is clear. Cancel your plans, wear a mask if you go out, and use good judgment. And please stay safe and stay healthy and stay at home. This is my city, and this is your city. And I send you strength and love in this toughest night. We will get through this together. Thank you very much. With that, I'll take questions. And as always, I'll also speak in Spanish. And I've got a phone here for the questions tonight. So let's go to our first one.
Our first question comes to the line of Claudia Prescuda with KNX News Radio. Go ahead, your line is now open.
Hi, Claudia.
Hi, Eric. I have a few questions for
Sure.
you. So I just want to make sure, were you actually offered any kind of a post, or was there no offer on the table? And I have a couple of follow-up questions.
Go ahead. Why don't you go to the follow-up questions?
Okay, I'm sorry. I'm having a hard time hearing you. So follow-up questions are, how your daughter may have been exposed, and I'm wondering, how you talk to her about this, like how you explain the situation to a 9-year-old. And then the third question is, given what you're saying about the severity of the situation with surge in LA County, do you think tougher restrictions are called for right now? Is it time to step up enforcement beyond just issuing citations to businesses?
Sure,
Thank you.
absolutely. Let me work backwards if you don't mind. So in terms of stronger enforcement and how we explain this moment, it was in conversations with doctors. What Dr. Fauci told us in March is actually coming to bear. And they think the biggest thing is not so much anymore what's open and closed or what we are and are not doing, that we will be vigilant about that. And I will support our public health authorities when they suggest we need to go further. And I wouldn't take that off the table. And I would absolutely support that, as I've consistently done when our public health professionals look at that, assess that, look at things around the country and around the world and make those recommendations to our Board of Supervisors and to our governor. I do think that whatever we can do, this is an extreme time that requires extreme measures. But what the doctors said is that the nature of this coronavirus, which is novel or new, as Dr. Fauci said, it was going to be the worst probably in December and even worse in January. And I said, explain that to me. I'm just, like you, an everyday layperson. I'm not a doctor. And they said the severity of the virus increases. So it's not, I don't want everybody to feel like we're just blaming you for bad behavior. I know so many people are doing everything they can to not get together. And while we'll hear about those cases where people are slipping or cheating, and we certainly and absolutely will crack down on them and assess other places where the evidence shows us there's spread, a lot of this has to do just with the nature of it. It's why the flu has a season that expands, and no matter what you do, it just is a stronger virus in these colder months. Second, we have no idea. We follow very strict protocols in our household. So we don't know how our daughter, there's nothing, we haven't mixed households. There's no behavior that she is engaged in that doesn't adhere strictly to the protocols of our health officials. And how do you explain it to a child? It's a scary thing. I'll admit she had some tears in her eyes, but I reassured her that it was going to be okay. And like I said, her symptoms now are pretty mild. Her fever's gone. She's going to be all right. But it's a scary thing, I think, for our children. And I want to speak to children whose parents might be sick, because I know for many of them, it's a very scary thing to know that your parent is sick. The majority of people, do not go to the hospital, and only a fraction of them have their lives in danger. We know for those who have lost someone that this is a deadly disease, but I want you to be there for your parents, to be confident that we have good doctors and people who care for your family. And if it's your child, no, the same thing. We will make sure we save lives. The children are at a very, very low risk. They don't need to fear this, but they do need to follow all the protocols so they don't become the inadvertent spreaders to a parent or a grandparent that could put them at great risk. In terms of your first question, absolutely. Joe Biden has told me for the last 2 years that he was very interested in me coming to Washington, D.C., and there were things on the table for me. But I said to them very clearly, I talked to Ron Klain, who's the new chief of staff. I said, I need to be here now. It's one of the toughest decisions of my life, but it's not a tough decision, because here in Los Angeles, this is a time to lead and not to leave. Thank you, Claudia. Next question, please.
Next, we turn to the line of Dakota Smith with the LA Times. Please go ahead.
Hi, Dakota. Good evening.
Hi, good evening there. I hope your daughter's okay and that you and your wife are also both safe from the disease.
Thank you.
Just on the, in terms of what was on the table of the job offers, can you explain what was offered? And secondly, does this mean that you anticipate, well, I guess I'll just put it in a different way. Mm-hmm. Do you intend to serve out the last 2 years of your term at this point? Thank you so much.
Sure. I've always kept my counsel with the president, now president-elect, I should say, and my advice that I've had, whether it was when I was honored to be one of the 4 co-chairs to help him select a superb vice president, whether it's as national co-chair or even now as co-chair of the inauguration. So I'm going to keep that counsel private. I think that's what he and other candidates and everybody else deserves. But in terms of service, I just am crystal clear about this. I signed up to serve for 2 terms. At that time, it was 4 years each, 8 years. I don't feel right about leaving, and my heart is here. This is where, just to reiterate, I need to be. This is where I want to be. And at the toughest moments, that's when you lead. I've had opportunities in the past to run for things and didn't run because when I go to voters and say I want to serve, I think I was clear with them. And when I got elected to a 2nd term, I wanted to serve. I'll never get the chance to be mayor again. I'll have the chance to do other things in my life, but this is what I said, the honor of a lifetime. And at this moment, when we have so many amazing people marching together that I'm helping to lead, from our departments and our city council and our other elected officials at the county level, my fellow mayors and council members in neighboring cities, this is a moment that demands that we lead right here. And so I feel very strongly, and I'm very, very much at peace with that. Thank you. Next question.
Next, we turn to the line of Ron Lynn with the Los Angeles Times. Please go ahead.
Hi, good
Hi,
evening.
Mr. Mayor.
How are you, Ron?
For taking our questions. That's
course.
much to you and your family.
Thank you.
I have three questions for you.
Sure.
You mentioned that at a certain point, it's possible LA County could declare a system-wide crisis. Can you elaborate more about what that means? Second question, should residents of LA be prepared for a New York City-style surge in which the chance of dying from the disease soars because the ICUs are just too full? And finally, in regards to Manhattan Beach has enacted a workaround to the ban on outdoor restaurant dining by declaring outdoor dining spaces just outside restaurants as public spaces, a policy the LA County Health Officer has said was decidedly not safeguarding public health. What would be your message to Manhattan Beach and other people who are not following the spirit of the LA County Health Order or the state health order? Thank you.
Sure. Let me start with that last one as well. First, let's start with the people who are suffering the most, our restaurant owners and workers. We're trying to step up with the SERVE program for our workers. The county has surged $10 million in in grants for our restaurants. But we really need Washington to step forward. The Restaurants Act would make this not even a decision we'd have to even debate. If we lived in a country like other countries have done that would step up and put public health first nationally, we would help our restaurants survive, help those employees get paid, and do the right thing for public health. It's unconscionable that we have to choose between those. And I think it's putting lives at risk. All of us would love to eat outside, but that's a much lower priority than the livelihoods of the people who work there. And the highest priority is saving the lives of people who we hope will have the chance to still be here to dine out. So I would hope that any city and any place would do everything that we can to make sure that we are keeping people safe and adhering, as we do in the city of Los Angeles, to the LA County health orders. Second, the surge, I don't know whether we should be prepared for it, but we should be prepared to picture it right now and do everything we can to avoid a New York or Northern Italy-like scenario. Surging is different. That surging is already starting now, that they're at 0% capacity. Surging just refers to repurposing spaces, adding shifts, and allowing hospitals. Remember, when they get to 0% capacity, it doesn't mean now that people are lined up in the hallways. It means now other surgeries get canceled, other spaces get converted. The excess ventilators that we've now stored up can be moved into spaces. Some hospitals can convert non-ICU spaces into ICU spaces, but other hospitals can't. And so an ambulance might show up and there's no space for that person in that hospital. And we're going to see that happening in coming days, where they're searching for the hospital that has one more bed, one more ventilator, one more doctor and nurse available. I know there's discussions about all sorts of things, from nurse ratios to, as I mentioned, doctors and others coming off of the national registries. But we should be prepared that could happen here, and that should inform everything that we do right now. And in terms of declaring a crisis, I'll refer that to, obviously, our Department of Health Services and Dr. Gali, who can speak to it more. But what it essentially triggers is now we are in an emergency setting where it may be that all elective procedures, again, should be canceled, where we look at those lists of medical professionals that we built up at the state level and here in LA and mobilize them, where certain rules have to go to emergency rules. In other words, it's bringing everything forward to make sure we don't have to have those harrowing visions of people in hallways dying and doctors have to deciding between who gets that last ventilator and not. So that is what it refers to. And they are very clear with us that could be coming in a matter of days. Some hospitals essentially are there. Others that I've talked to still have quite a bit of capacity and feel confident to meet this moment. And we just don't know when the peak will be. And let me say this very clearly to everybody out there. The peak is going to be determined by us, not by the virus. If we take Christmas as something we just have to get together with family and cheat, and maybe it's just two people, so it's two households and it's just our parents or our grandparents, that will result in a bump like we saw in Thanksgiving. And we can't take a third bump. We had a bump before Thanksgiving, we had a bump from Thanksgiving, and if we have a third one, this peak may not be until late January. And if it keeps soaring for the next 3, 4, 5 weeks, we will have nothing left to meet this moment. Thanks, Ron. Next question, please.
And our next question comes from the line of Lee Ross with Fox News. Go ahead.
Hey, Lee, how you doing?
I've been doing well. Thanks, Mr. Mayor. Certainly, best wishes to your daughter and your whole family.
Thank you.
In the days ahead. There is no one inside of the Delaware River, perhaps better informed than you, about COVID best practices and the workings of the Biden campaign and now transition. We've learned tonight that Congressman Richmond has tested positive, and he was with President-elect Biden and many others at a political event just 2 days ago in Georgia. What concern should Angelenos, all Americans, have about this development, especially as it relates to Mr. Biden's well-being?
Sure. Well, I think all of us deeply care about our national leaders, even when we put partisanship aside. No matter what your political party is, we want to make sure that our commander-in-chief is protected and healthy. I know there's been talk about, and I certainly would support Joe Biden being at the top of that list as one of the most essential workers in America, in a vulnerable age and everything else, and also as an example to those who might have doubts about the vaccine to be at the front of the line. And I hope that that happens very soon. Cedric Richmond was a fellow co-chair of the campaign. And so I sent him my best wishes, and I hope that he has a speedy recovery. It just shows that everywhere now how widespread this is. And the protocols within government, certainly that we do here in the city of Los Angeles, where everybody basically who can work remotely is working remotely, frequent testing goes on, et cetera, is really important in all workplaces that are still for essential workers. And I see the president, vice president, this administration, obviously at the very top of essential workers. For anybody who would doubt that and say, oh, those are politicians, why from the line? These are our leaders who will marshal the resources for the vaccine, for all the testing, for the standing up of our economy. We need them healthy, we need them well. And Joe Biden is an extremely healthy person. He's a very vigorous person as well. And we want to make sure that we protect that. So we wish Congressman Richmond a speedy recovery. Then no sense of, I know that the president-elect gets tested regularly and has no evidence of him being positive in any way. So let's keep him that way. Let's keep him protected. And let's have folks of his generation and folks of that importance vaccinated at the front of the line with our essential workers as the protocols and the plans demand.
If I can quickly follow up
Sure.
on that, just when it comes to quarantining, what you unfortunately are having to do now, what are the best practices that should be followed by those who've been in proximity to Congressman Richmond? And does that also include the president-elect?
I don't know, because I don't know how close they were in I believe it was in Georgia, but there's no question that the best medical professionals have been advising this transition and will be part of this administration. So I know he's in excellent, excellent hands. Usually the protocols, though, in general, are if you've been for 15 minutes less than 6 feet from somebody, that you should quarantine. That certainly is the case with my daughter, who I spend a lot more than 15 minutes with a day and a lot closer than 6 feet. So that's usually the protocol. If it is somebody who is positive, it's 10 days from the first moment your symptoms were there, and a negative test. They usually then ask another 24 hours after your negative test, or 48. And for somebody who's quarantining because you've been exposed to somebody who's been positive and could have been infectious, it's 14 days, 14 days of quarantine. Thanks, Lee. Next question, please.
And our next question comes from the line of Chris Palmieri, Bloomberg News.
Hey, Chris, how are you?
Hi, Mr. Mayor. Thanks for taking my call.
Of course.
So, we've been pretty good here. We've had some of the toughest restrictions going all the way back to March. Business is still out and reopened. And I'm just wondering if you can explain why we're having this surge. I mean, there's something unique about the demographics or the nature of work here in Southern California, and what does it say about these restrictions like closing restaurants? Why aren't they working?
I think we should be really careful not to reduce to one thing. I think everybody wants simple answers to a very complicated virus that we're smarter about, but that will never be about just black and white answers. The answers why Los Angeles has always been very vulnerable is we're the densest metro area in America, and viruses spread when people live densely. People don't think we are because we don't look like Manhattan, but we are the New York metro area, which includes Manhattan, is actually the 5th densest in America. LA, Long Beach, our area is the densest in America. So that's number one. So that means when somebody comes home, sometimes people don't have an option to go someplace else. They don't have their own bedroom. There's shared spaces, and a virus will spread. Second is we're more vulnerable. We have health indicators and poverty that have always made Los Angeles a more vulnerable city. The combination of that density and that vulnerability It's why one of the reasons I've been so proud that for most of this year, we have been able to save thousands and thousands of lives, even given that. With our Angelenos experiencing homelessness, for instance, they have a lower infection rate than those who are housed because of conscious things that we have done. But I come back to what I said in the briefing, talking to medical professionals, it really is right now as much about the nature of the season and what happens to coronaviruses and other similar diseases at moments like this, where there is always a season and a surge because the virus itself becomes more severe in this weather and at this time. It doesn't mean that the things we've done have failed. In fact, we'll never be able to quantify how many lives we are saving by having done those things. That's like saying, hey, I'm wearing a mask and I should stop wearing it because cases are going up. Absolutely not. Keep wearing it. It's one of the many things. It's just that this virus is not going to be, as we see around the world and around this country now, stopped. It'll be minimized. Until we have a vaccine, it will not be stopped and brought to zero. But it's so critical that wherever we can make that discretionary decision of not seeing another household, of not going out if you don't have to, of deciding to work from home, even if it's driving you crazy, staying at home. This is the moment to bring that willpower to bear on top of a really tough severity that comes with this season. And it's my belief that that's the driving factor right now.
Thank you.
Thanks, Chris. Next question, please.
Our next question comes to the line of Anna Scott with KCRW.
Hi, Anna. How are you?
I'm good. Best to you and your family.
Thank you.
Sorry to hear that news.
Thank you.
My question is about homeless encampment cleanups. The city council recently expanded the Care Plus cleanups from just around bridge housing sites to a few encampments in District 15 in Wilmington and San Pedro. I was at one today where some people had to relocate. And so my question is two parts. One is what is your stance on this expansion and all these cleanups happening right now? And the second part is why isn't there a citywide policy right now on homeless encampment suites and also safety protocols with this a very serious moment in the pandemic?
Sure, absolutely. Thank you, Anna. And a good article, by the way, the other day too. Good journalism, and thank you for that. Two things. One is I've set up, we have dual responsibilities in the city. One is to a kind of a public health and sanitation to keep sidewalks not only safe, but clean for people who use them and go by them, but also people who are living on them, unfortunately. And I've always looked at the importance of keeping those clean and doing regular cleanings as something, just as we know when our trash is going to be picked up, if we're lucky enough to be housed, those who are unhoused should know in a very humane way the days that cleanups happen, should get the protocols to make sure things are sterilized, because there's really terrible conditions that they're living in on the streets, and the vulnerabilities have led to too many people dying. And this is about saving their lives, as well as our responsibility together with really the bigger players in this, county, state, and federal government, to try to find housing and mental health and other care solutions for people who are experiencing homelessness. We have to do both. We can never choose between those two. Care and Care Plus was something we put together to allow both. A lot of communities were always calling, saying, hey, this is a mess here. Is the city doing anything to keep this cleaned up? There's huge amounts of trash outside. My child's going by. We don't know if it's safe in a COVID environment, what's going on there. And so it's very important for us to do that, but with services, with outreach, with predictability, with showers, with services, with helping people get their IDs so they can sign up for income that can help them get off the streets, with housing navigators, with medical and mental healthcare professionals. And that is something I'm very proud of, that we've done that with a services-led approach. But half of the teams are district by district, so that council members can help respond to those places where they're getting constituents and others who are saying, can we address the situation? And then half of them are citywide, and there is a citywide strategy. They go regularly to certain places to make sure where we've seen illegal dumping, where we see cleanliness and unsanitary conditions, that we can humanely meet that regularly. I do not support the idea of some sort of just massive sweeps of people. That just moves people from one place to another. I do support moving people into housing. I do support expanding our options for shelters. I do support our hotels and motels and Project Room Key and Project Home Key. And so as part of the discussions right now in the Alliance lawsuit, we're also trying to work out those protocols while we have council members who I know are confronting some very difficult situations on the streets. But hopefully the right model that can evolve and that we can adopt together with that lawsuit, together with advocates and together with the county, would really continue to be a services-led approach, a predictable way to say, hey, at certain hours or certain places, you got to pack up and allow us to clean, or even certain places where we have shelter beds, please avail yourself of that, or even better, housing. And it's only in those situations I've always consistently said that you can then demand that people can't be someplace. And I hope that we're getting closer to that because of the thousands of both beds and units that are part of the pledge that we've taken, both under the lawsuit and under our own just desire and my own passion to make sure that homelessness one day is a thing of the past. Thanks, Anna. Next question, please.
And our next question comes from the line of Alex Michelson with Fox 11 News.
Hey, Alex. How are you, man?
Hi there. Good to talk with you. And we're all thinking about you and your family tonight.
Thank you.
I have one question about that, about does being at home, does having this be so personal, literally in your life right now, does that change the way you think about coronavirus at all and how families and what they're going through? And secondly, just to follow up on the Biden job question, was there a specific cabinet post that you were offered and turned down? Was there a specific White House job that you were offered and turned down? What do you mean by things on the table?
I'm going to leave it at that. I'm going to keep my counsel with conversations I've had because there's extraordinary people joining this administration. They deserve to be the ones whose names and voices are lifted up. And I'm so proud of this president, vice president, and his senior staff, the choices that they're making. It was just a very personal thing to me. It was clear there was interest in more than one category of things and more than one area. As a mayor, you get to touch many different issues. But I meant what I said. Sometimes the truth is the truth. I meant what I said when I was asked, I don't know, a month and a half, 2 months ago. I said, it's more likely than not I'm going to stay here because that's where my heart was. But I also said, you don't turn down a conversation or a phone call with the president-elect if he calls. And so I'm going to keep that counsel as something, as a very dear friendship that I have with him, private. But I want mostly people of Los Angeles to know that that wasn't a hard decision for me. I don't think that you leave a city in its toughest moment when you're its chief executive. And this is a great, great honor of a lifetime, extraordinary job at a toughest moment. And I'm not somebody who backs away from that. Second, your first question about whether this changed my perspective, I guess it has. I mean, to see the tears in your own daughter's eyes when she learns that she had a positive test, of course. I mean, I'm a father first. My greatest title is not mayor. It's Maya's daddy. It's Amy's husband. Those titles, will long last after this time. And of course it was. But we reassured her. And, we've lost a cousin in my family who died of COVID-19. That was a moment. I think the moments that have affected me the most is when I've called, as I did this week, the surviving spouse of somebody who's gone. When I talk to children whose father is no longer there, as we've lost firefighters and police officers and folks who worked in our housing authority, people that I've known. This is not new. I've been in many ways at the front edge of, I have to be not only a leader in this city, but a pastor in some ways to so many people. And I feel that pain every single day. I carry it with me. It's traumatizing to all of us, and especially to families who have lost them. But I think what hit home to me is just, when you hear the statistic that this is now everywhere and you should treat everybody as if they're infectious, it's real. It really is. And so for folks who think that it's not going to hit them, it can and it will. So do everything to make sure it doesn't. Thanks, Alex.
Thank you.
Next question.
The next question comes from the line of Albert Cerna with the Boyle Heights East. Please go ahead, your line is open.
Hey, Albert. How you doing?
Good evening. Thank you for taking time. I'm good, thank you. And I'm sorry to hear about your daughter. I hope you recovery to her.
Thank you.
I wanted to clarify, is the city still planning to use the convention center for more COVID cases? And I also wanted to ask, Sheriff Villanueva said that he would not enforce Governor Newsom's stay-at-home order. Do you think that has any part to play in the rise of cases that LA County has seen?
So I hope, I've always said we can't enforce our way out of this. There's just too many of us versus, the number of law enforcement officials or city officials. We do that to make sure that people know that we do enforce in the city of Los Angeles. But we obviously, when folks were saying, hey, turn LAPD into a mask enforcement force, that's not what I want my officers doing. I want them dealing with serious crime. I want them being the heroes that they are and the folks that are going to help somebody in a truly tragic situation, not as the kind of gotcha police. So much of this relies on us. But where there's serious violators, whether it's a business that stays open, people, as we've read about, having underground parties, folks that we had doing house parties, those do need to be enforced. The message needs to be sent, and people need to know that those actions kill people. In terms of the convention center, though, and so sorry to finish the thought, no, I don't think that's the main cause of the rise. I think the main cause of the rise, again, is the season and the severity. And I think a lot of people, whether it was going to houses and maybe going indoors to watch the Lakers and the Dodgers, whether it was election celebrations, Thanksgiving gatherings, that I think a lot of people kind of bent those rules on households, and hopefully not at Christmas. I think that is really what's driving it. And that we had a lot more things that are open. And again, businesses did an amazing job, but that didn't mean that people weren't 2 feet away from each other with their masks off for an hour or two for a meal or hanging out in certain situations. I think we've seen research that shows sometimes this can happen in stores, even as we have to keep them open for essential needs. So I think it's a combination of those, really driven, though, by the severity of this season. Second, the convention center, no, we are not looking at that. We haven't researched it up. And we've actually asked, we said we're willing to do that. The city is standing by and available. But that was one of the lessons we learned. And hospitals said, we'd much rather go to our own parking lot, do the triage there, the intake there, and open up some spaces inside, convert our own conference rooms, et cetera. Because the issue for the convention center is not the space, though that's an issue. It's also the staffing of it, where there just aren't enough medical personnel, let alone ones that have worked together, let alone who know where all the equipment is and getting that going. That's an immense undertaking. And we've learned that that's much better done in the existing hospitals by the existing hospitals as well. I never take anything off the table. I mean, if we see this double and quadruple and get worse and worse and worse, of course, we'll look at everything and we'll look at anything. But right now, no, it is not something that we have surged up or are preparing to surge up. Thanks, Albert.
Thank you, Matt.
You bet. Next question.
And our next question comes from the line of Joel Pollack with Breitbart News.
Hey, Joel. How you doing?
Go ahead, your line is open.
I've missed you.
How are you?
You been okay?
Thank you. All right. Happy Hanukkah.
Thank you. You too.
Just a brief question, and I apologize if I'm repeating an earlier question
No worries.
because I came to the call late, but there have been a lot of stories in the last week or so about the new LA County District Attorney, George Gascon, and some of the reforms that he's launched. And there's been a lot of concern, for example, about the double homicide case with Officer Solano. And since you endorsed District Attorney Gascon, I'm just wondering if you have any reaction to those stories and to the very aggressive approach he's taken to implementing his policies.
Sure. Joel, I'll be 100% honest with you that I have not read those articles yet, and I haven't looked at those policies, though a couple people today reached out as well. So I plan to do that, and I'm happy to answer that in coming days. The George Gascon that I know is somebody who is committed, and I worked with very closely to making progressive law enforcement work. I knew him as an LAPD officer and one who I worked with closely when I was a council member, and somebody who's intelligence and judgment, and I think always looking at can we do this better was something that I was happy to endorse. That said, with people who get through, I will always look at where we agree and places where we may disagree. I hope that we will always balance the needs to make sure that we lock up way too many people for way too long, give them way too few options for ways out of just becoming repeat offenders. And we've done reform without helping people. We see it on the streets of LA today. Get into a job, get into housing, deal with addiction, mental health, et cetera. And so I embrace anything that we can do around that. On the flip side, of course, where we have dangerous and violent criminals, we have to make sure, and I know a lot of people have been defined as that, maybe too aggressively, but there are clear cases in which we need to make sure that folks who are stalkers, for instance, are not coming out and going to be attacking their victims, that we deal with people who have taken the lives of our law enforcement officers, et cetera, and then we make sure these people stay locked away and locked away for a long time. So, that's what guides me. But I have to admit, I've been so focused on these numbers and so focused on COVID. I can't respond to that tonight, but I'm happy to do that. That's not to just kick it off. I'm happy to answer that another night. Thanks, Joel. Next question, please.
And our last question comes in Spanish, from the line of Denora Perez with Telemundo. Please go ahead.
Hi, Denora. Hola.
Hi, Mayor. I'm sorry to hear about your daughter. I hope
Thank you.
has a speedy recovery and everyone stays well. I have a question for you, if you can respond in Spanish as well.
Sure.
In regards to the ICU capacity in Southern California, have you heard how long the wait times are for patients that are being transported in ambulances to some hospitals? We've heard of hours. I'm not sure if you've heard of the same thing. And then what can be done? Are there any additional funds coming in or bringing additional resources? You also mentioned the USNS Mercy that had about 1,000 beds. Is that even a possibility?
Thank you, Nora. Let me answer just briefly in English, and then I'll switch to Spanish. And then, as always, I'll give my overall address in Spanish as well after I take a sip of water. Just thank you for all the questions to the press. I really appreciate the opportunity, and I'm glad this has worked technologically. So first, I think that the USNS Mercy, the best part of that was the medical teams. I think as a ship, we don't look at that necessarily needing to add capacity. But like I said, I don't take anything off the table. But it didn't work. It was kind of too tight quarters for, in fact, I think they had a little outbreak even of COVID-19 on the ship. But the medical teams did amazing work and deploying those out. This isn't so much a problem of space. It's a problem of personnel. But my understanding is there's medical teams now from the United States military are all around the country already deployed. Remember, it used to be that it was surging here and there. And whether it was nurses and doctors who are traveling nurses and doctors could kind of surge to those areas, or some of our military medical personnel could surge, that just option doesn't exist anymore. So there are hospitals that are reaching their capacity, and I think we are hearing those stories of long waits or having to transfer to another place, and I think we'll hear more and more of them. But most hospitals are able to accept people into intensive care pretty quickly still today. But it's very, very fluid. That could change quickly. En español, tenemos hospitales sin capacidad para las camas de cuidado intensivo, pero la mayoría de los hospitales tienen la capacidad para más personas. Necesitamos más doctores y enfermeras. El problema no es el espacio, hay más espacio en total en la mayoría de nuestros hospitales hoy, pero es muy difícil encontrar los doctores, las enfermeras y otros trabajadores médicos en este punto, y no hay mucho en el país. En el pasado, los doctores viajando puede viajar a Los Ángeles de Nueva York o otros lugares, pero ahora esta crisis está en todas partes de nuestro país y es muy difícil para encontrar nuevas personas a venir a Los Ángeles. So with that, let me thank you, everybody. Again, thank you for your well wishes for our daughter and for the family, and right back at you for everybody who is going through this, who is suffering. And please do everything you can to help those who are suffering this holiday season. Go to thatmayorsfundla.org/COVID-19. And if you can give $1 or $1 million, everything helps. Thank you. En español. Muy buenas tardes, Los Ángeles. Esta noche les estoy hablando desde mi casa, no desde mi oficina en la alcaldía. En lunes, mi esposa me llamó para decirme que nuestra hija, Maya Juanita, no se sentía bien. Tenía una fiebre y le hicimos una prueba de COVID-19. Su resultado regresó positivo. Maya se siente bien y tiene síntomas moderados. Mi esposa y yo hicimos una prueba y recibimos resultados negativos. Maya está aislada durante 10 días desde cuando empezaron sus síntomas. Amy y yo estamos en cuarentena, en cumplimiento con las pautas de salud pública. Y continuaré trabajando de manera remota cada día por esta ciudad como su alcalde. Nuestra familia es muy cuidadosa y lo que estamos pasando en nuestra casa esta semana es lo mismo que tantos están pasando por toda la ciudad y en el país. Nuestra ciudad está cerca de administrar un total de 3 millones de pruebas y hemos aumentado nuestra capacidad a 41.500 pruebas al día. Y nuestros sitios de prueba, desafortunadamente, tienen una tasa de positividad alarmante de 19.6%. Algunos sitios han visto tasas de positividad de casi 30%. Este es una emergencia. COVID-19 está afectando a más familias, más angelinos, ahora que en cualquier momento desde el principio de la pandemia. Hace 3 horas, el Comité Consultivo de la Administración de Alimentos y Medicamentos aprobó la vacuna de Moderna y esperamos la aprobación final de la FDA muy pronto. Para principios de la semana entrante, tendremos 6 millones de dosis de esta nueva vacuna por todo el país, además de la vacuna de Pfizer. Y mientras la vacuna nos da esperanza, este momento es espantoso con la gran posibilidad de devastación que tenemos en el horizonte. Cada minuto muere más que una persona de COVID-19 en nuestro país y perdemos más seres queridos de COVID-19 cada día que murieron en el 11 de septiembre, cada día. Pero sus acciones individuales son más poderosas que la vacuna. Usen mascarillas, no se reúnan con otros y quédense en casa cuando puedan. Porque aunque sea una pequeña reunión para Navidad o Año Nuevo, puede tener impactos desastrosos para toda nuestra ciudad. Cuando suben los casos, poco después suben las hospitalizaciones. Ahora hay 5.100 personas hospitalizadas con COVID-19, el doble que el mes pasado. Y 1.035 pacientes están en nuestras unidades de cuidados intensivos, el doble del mes pasado también. Y ahora los centros de cuidado intensivo en nuestros hospitales en el sur de California tienen 0% capacidad. He estado en contacto con los líderes de nuestro sistema médico. Su mensaje a todos nosotros es muy, muy claro. Nuestros hospitales han llegado a su máxima capacidad. No tienen más camas y se están quedando sin personal disponible. Los grandes hospitales tienen cientos de personal en licencia médica mientras luchan contra el virus ellos mismos. Esta mañana nos dijeron, si las cosas no cambian, vamos a ver que el sistema se va a descomponer delante de nuestros ojos. El Estado ha ordenado 5,000 bolsas de cadáver adicionales y refrigeradores para apoyar a los forenses de la región. Esta es una emergencia y me da miedo y les debe dar miedo a ustedes. Sin embargo, en este momento, los hospitales y trabajadores médicos conocen más sobre esta enfermedad y han aprendido lecciones críticas sobre cómo tratar a los pacientes de manera eficaz y efectiva. Tenemos confianza en los profesionales en la frente de esta lucha y estamos trabajando con ellos para implementar las mejores prácticas que han desarrollado en los últimos 10 meses. Equipos en cada hospital han desarrollado un plan de sobrecapacidad para acomodar más personas. Muchos hospitales están cancelando cirugías opcionales, pero nuestra mayor preocupación es el personal. Si podemos colaborar con el Estado y el condado para traernos más personal médica de otras regiones. Hospitales nos han dicho que es mejor concentrar ese personal en los hospitales existentes en vez de desplegarlos a centros profesionales nuevos, como el centro de convenciones. Para todos nosotros, nuestro más importante deber es de apoyar a nuestros hospitales y nuestro personal médico. Así salvamos vidas. Mientras luchamos contra el virus, también nos enfocamos en proteger sustentos de vida. Esta pandemia ha causado una serie de crisis económicas y financieras para familias para todo el país y quizás la más trágica en la inseguridad alimentaria. Esta noche estoy lanzando la iniciativa Given, una colaboración con el Mayor's Fund de Los Ángeles para brindar $300 en efectivo a miles de angelinos para comprar alimentos y otras cosas esenciales. Given han recibido $550,000 del Mayor's Fund y queremos lograr $3 millones para poder ayudar a por lo menos de 10,000 hogares para el final del año. Para las personas quienes han perdido su empleo o una parte de sus ingresos, esta ayuda es crítica para poder alimentar a su familia. Además, un estudio de USC reveló que personas sufriendo de inseguridad alimentaria fueron 2 veces más probables a ser infectados con COVID-19. Podemos ser parte de la solución. Para ayudar con una donación, visita mayorsfundla.org/COVID-19. Se ha especulado que me iría de Los Ángeles para trabajar con la nueva administración. Desde que Joe Biden y Kamala Harris fueron elegidos presidente y vicepresidente, he continuado aconsejando a la administración sobre las pólizas que nos ayudarán a recuperar y confrontar este momento. En este momento, mientras hay tanto en juego, no hay nada más importante para mí que estar aquí como su alcalde durante la peor emergencia que hemos afrontado. La administración me preguntó sobre la oportunidad para servir a nuestro país en Washington y les dije esta semana que mi ciudad me necesita ahora y que yo quiero estar aquí y necesito estar aquí. Ser su alcalde es el mayor honor de mi vida y siempre trabajaré para recuperar y avanzar hacia un nuevo y mejor futuro a Los Ángeles y para Los Ángeles. Y estoy emocionado de hacer este trabajo con esta nueva administración, quienes serán amigos y ofrecerán el apoyo que necesita nuestra ciudad. A todos quienes se están quedando en casa, los reconocemos y les agradecemos. Para todos, por favor, recuerden, cancelen sus planes para reunirse con otros. Esto es lo que debemos para vencer este virus peligroso. Tenemos el poder para salvar a otros. Entonces, quédense seguros, quédense saludables y por favor, quédense en casa. Mucha fuerza y amor, Los Ángeles. Gracias y buenas noches.